Hello, everyone. I am Dr. Tawab, co-chair of ISPRM's Communications Committee, and today I'm really excited because I will be conducting the interview of the keynote lecturer of ISPRM 2026, which is none other than Dr. Ross Zafonte, who is a well-known figure in brain injury medicine throughout the world, and he is really known for his book, The Brain Injury Medicine Principles in Practice. He is currently the Executive Vice Dean for Clinical, Academic, and Faculty Affairs Professor at University of Missouri, and he's a Professor of PM&R and Professor of Anesthesiology as well, and Charlton Professor Emeritus of Harvard Medical School. Welcome, Dr. Zafonte. How are you doing today?
I'm doing great, and thank you for having me, Tawab.
So, your keynote lecture for ISPRM 2026 conference, the title is really interesting, that is brain injury a chronic disease? So would you tell us about what are you going to talk about?
I'd be thrilled to do so. First of all, it's a great privilege, the opportunity to speak to the ISPRM, a remarkable organization that changes our field worldwide. But I think we're going to be a little provocative. We're going to ask the question, is brain injury a chronic disease? And if so, what domain areas does it impact? How long does it take to happen? What are the specific issues that happen from a behavioral, neurodegenerative, cardiovascular, and honestly, even brain cancer related risk? And then why do these things happen? Why is this group selected in so many ways? And what can we learn about the mechanisms that might be producing this?
I think this is a very interesting topic because, because it sort of changes the way we think about brain injury medicine. And because previously we used to say that, for example, brain injury is an acute thing, no matter what the cause is. But now if we are talking about it, that is it a chronic disease? So it sort of changes the way we approach this disease. And I think it would be really interesting to see your perspective and overall to hear from the audience as well, that what are their concerns or what are their thoughts about if it is a chronic disease. So do we really need to change something, how we approach this disease?
Well, I think you're right. I think this is an interesting conceptual. Have we been looking at this the wrong way? Have we been saying it's an injury and then we're done, versus really taking on the fact that this may be an event that produces lifelong risk factors that we have to think about over time in people with brain injury. Lifelong risk factors that affect everything from their heart to their head to their overall function to their neuroendocrine function. We've had hints of this for years, but we hope to present some data that I believe will be more declarative about that, and then really refine why some of these things might be occurring, and they may be multifactorial.
It is really interesting to hear that is it some sort of a syndrome? Because it is not just affecting the brain, it is affecting the endocrine system, it is affecting the cardiovascular system as well, and the musculoskeletal system as well.
Yeah, I think what we may be seeing is not everybody gets ill, but many people do. In the old days, in my era, we said people either stay the same or get better. And that's in part true and in part not true. And what we're seeing is that there's an elevated risk of certain diseases that probably should be evaluated for very, very early on. When we look at some of these time to event curves, many of these things take off very quickly. And so the follow-up care, how we think about planning for people with a life with brain injury, what are the risks in everything from mortality to long-term brain cancer risk? And why do these things happen? I think it disrupts the way we consider this in many ways.
So these are some really interesting and important questions. And I'm really excited now to listen to you at the conference in Vancouver that is going to occur from 17th to 21st of May 2026. Thank you so much, Dr. Zafonte, for giving us this sneak peek into your keynote lecture. And for the audience, I would like to request you all to register, because 20th January is the last date for early bird registry. And I would urge you all to take out your time to attend this very interesting conference and listen to this very interesting keynote lecture, where we sort of shake the way we actually think about brain injury medicine. Thank you so much, Dr. Zafonte, for joining us today.
It's my pleasure, and thank you. I look forward to seeing everybody in Vancouver.